Our last two speakers represent the NIAMS Coalition, a group of professional and voluntary organizations concerned with the programs of the NIAMS. Since the Institute's inception, the Coalition has played a vital role as a liaison among the researchers that NIAMS funds, the patients who benefit from the Institute's research investments, Congress, and the general public. Before introducing these two speakers, I would like to acknowledge two people who really helped revitalize the coalition in the last 5 to 7 years. One is Amy Melnick. I don't know if she's still here. Thank you, Amy. And Sheila Rittenberg from the National Psoriasis Foundation, who couldn't be here. Amy is at the Arthritis Foundation, and Sheila both really revitalized and made the coalition far more proactive than it had been in the past. And I would like to thank many of the current coalition members who are here. And I'd like to provide the opportunity for the co-chairs, Ms. Annie Kennedy and Ms. Tiffany Schmidt, to say a few words. Let me introduce them by telling you that Ms. Kennedy is Senior Vice President of Advocacy for Muscular Dystrophy Association, where she oversees the organization's legislative and health policy efforts and serves on more than a dozen advisory committees. And Ms. Schmidt is the Vice President of Socioeconomic Affairs at the American College of Rheumatology and coordinates the ACR's government affair activities and works with rheumatologists to educate members of Congress on rheumatic diseases. Please join me in welcoming both Ms. Kennedy and Ms. Schmidt.
So we are the only thing standing between you and the reception, and we're very aware of that, and it's been a terrific day. And we're going to tag team a little bit, if you will. I'll be the ghost of Coalition past and present, and Tiffany is going to be the ghost of Coalition future as we recap a little bit about who we are and what we have been working on. So it's a pleasure to be here today to celebrate the 25th anniversary of the establishment of the National Institute of Arthritis, Musculoskeletal, and Skin Diseases. And more, it's a distinct honor to be representing the NIAMS Coalition. On behalf of the Coalition, we'd like to especially thank Dr. Katz, Dr. Carter, and the organizers of today's event, whose inclusion of the Coalition representatives in today's program is a direct reflection of this Institute's unparalleled commitment to stakeholder partnership and community outreach. Tiffany and I, who serve as the co-chairs of the NIAMS Coalition, are delighted to have an opportunity to provide a brief overview of our Coalition's membership and past activities, as well as to highlight some upcoming events and initiatives. Shortly after the inception of this extraordinary institute, a unique collaboration was formed among the many stakeholder groups sharing in the mission of NIAMS. This collaboration, formalized as the NIAMS Coalition, and the robust partnership between the Coalition member groups and the leadership and staff of the Institute, serve as a model of public-private partnership and as an example of what can be achieved when shared visions aligned and resources are leveraged. Comprised of more than 70 organizations representing a wide array of medical associations, patient advocacy organizations, and science-based associations, we are a very diverse group, unified by our shared interest in advancing the critical research facilitated by NIAMS. Simply stated, the mission of the Coalition is to elevate understanding of the value of the National Institute of Arthritis and Musculoskeletal and Skin Diseases among policymakers and the public in order to foster increased federal investment into this institute. The Coalition's efforts, led by a steering committee of 12 member organizations, many of whom are here today, are focused on 3 unique and distinct communities: Coalition member organizations, legislators and policymakers, and the public served by the Institute. We strive to facilitate activities that keep Coalition member groups informed of Institute priorities and initiatives, and to enhance understanding of the resources and opportunities available to scientists, clinicians, and member groups through the Institute. Over the last 25 years, our activities have evolved to reflect the commitment to these communities. We are very proud to report that our Coalition is more robust today than ever before. Coalition activities include quarterly teleconferences hosted by the Coalition and featuring Dr. Katz, Dr. Carter, and NIAMS leadership. These topical State of the Institute teleconferences allow for an open flow of communication between member groups and Institute leadership. Activities also include the NIAMS Coalition Outreach and Education Meeting. Every 2 years, Coalition member groups are invited to participate in the Coalition Outreach and Education Meeting. This meeting provides member groups with an opportunity to network and share best practices on the importance of connecting science to the public while learning more about the inner workings of the National Institutes of Health and NIAMS. And of critical importance, as underscored this morning by Mr. Porter, our coalition efforts include outreach to policymakers and legislators. As those gathered here today well know, the stability and strength of this NIH Institute affects our nation's ability to combat some of the most difficult chronic diseases and most fatal diseases in the world. These diseases impact the lives of millions of Americans every day and cost billions of dollars in healthcare costs. But we recognize that the impact that federal dollars and research funding has on American families living on Main Street, USA is not always a direct line or correlation to policymakers and elected officials. Thus, as a coalition, we conduct outreach activities and facilitate opportunities for members of Congress and their staff to hear from the patient communities who we represent, the scientists and clinicians whose labs comprise local economies, and the leadership of NIAMS who are working to catalyze treatment advances worldwide. Past congressional awareness activities of the coalition have included requests to testify at public witness hearings of the Senate Appropriations Committee, and last fall we hosted a very successful NIAMS Awareness Day held here on the NIH campus. The day was a rare opportunity for staffers of congressional offices to get a first-hand look at the innovative research of the Institute and to hear presentations from Institute scientists and leadership. I'm going to turn it over to Tiffany, who's going to tell you a little bit about some of the things we have coming up in the next couple months.
So where are we now? That is the big question, and I'm glad that John Porter spoke earlier today because a lot of the issues that he spoke about trying to get members of Congress to understand what NIAMS does and what NIH really does is what we are trying to do as a coalition, and that is to educate Congress. And I want to say a thank you to Becky Molino and Amy Melnick and Shelley Rittenberg, as was mentioned earlier, because they really have helped us move forward. And I also want to thank Melanie Martinez and Dr. Brendan Bowe, who work at NIAMS, because they help us as we are trying to set up where we want to go next. And so what are our big plans? One of the things we are planning to do is have a congressional briefing in September. And in September, we are going to bring members of Congress to a room and try and educate them, because we realize that it's very difficult for members of Congress to come all the way out here. So we're going to try to have a briefing on the Hill for them. Another thing that we try to do is bring patients, health professionals, researchers, and physicians to Capitol Hill so that we can go from office to office and educate them. And much like many of the patients who were represented today spoke about, we use those people to go to the offices to help educate them. And so Mr. Stevenson, Mr. Beach, who spoke earlier today, Ms. Kunkel's in the audience someplace, Ms. Amy Leong, Ms. Emily Smith. I mean, we thank you very much, along with the researchers, physicians, and other staff in the audience. We need you each and every day to be thinking about how to contact Congress and to tell them what you are doing, because staff can't do it alone. We need everyone to help. And the patient stories and the researchers, I know the presentations today here were fabulous, and I learned a lot. And as I was sitting in my seat, I was thinking how much members of Congress could have learned as they were sitting here, and the importance of NIAMS. So another thing that we are looking at is an outreach day in October. So in October, we will have another meeting bringing all the coalition members together and other individuals so we can learn from each other. And it's really interesting how much you can learn from one another just by groups of people getting together. So one of the things that the ACR does is we have ACR AF funding, where we help bridge NIHK grants. When we have young investigators and they're not able to get NIH funding, yet we have bridge funding, and we do that with the AF. So that's something that we can share with other groups. At lunch today, when I was sitting with Annie, she gave us a great idea of how we could reach out to members of Congress at home. So that's one of the things that we do for Outreach Day. So I'll turn it back to Annie because she has a lot of great ideas and a lot of other people have great ideas as well. So if your societies are not members of the coalition, I encourage you to pick up some information out in the hall.
Or if you are members of the coalition and you'd like to get more involved, we welcome your involvement. We have work for everybody. So today we've heard many extraordinary examples of ways in which the existence of this institute has changed the research landscape and improved and extended the lives of millions of Americans. Dr. Katz, Dr. Carter, NIAMS staff, and leadership, on behalf of the tens of millions of Americans who are served by your tireless efforts and who are represented through this coalition, we thank you. Being diagnosed with arthritis or musculoskeletal disease or skin disease means something very different today than it did 25 years ago. We are very proud to be your partners, and we really appreciate the slogan for today's conference, "For you indeed are improving lives through discovery." So thank you and congratulations.
Thank you so much, and Tiffany, I must say, during my lunchtime with Becky Manillo, she also talked about the possibility of really bringing it to the Congress people's homes, as we've done in the past. I and other institute directors have visited, for example, Mr. Obie's congressional district and talked about what the NIH actually does. So a good idea, one that we would resonate, we would certainly resonate to.